Hello, this is Dr. Ben Young, and you are listening to the Perio Patient Podcast, episode number 41, and I've entitled this one, What is a Root Canal? A lot of times the topics come up because as I work throughout the day, I encounter patients who have different problems, and just recently I had a gentleman in who had a problem with a tooth, and actually it was more than one problem. And so attempting to describe what was going on with this tooth resulted in me needing to explain what a root canal is and what treatments are necessary if somebody needs a root canal and all the rest, and how it relates to periodontal bone loss, periodontal disease. And so what I thought I would do is kind of go through this with you. And this is not intended to be a definitive description of any of this. It is just to help you understand a little more about dental procedures that you might have had or need to have, and help you understand and navigate this area. First off, let's talk about periodontics and endodontics. There are two different specialties. Mine is perio, and it's the donics part we have in common, and that is dentistry in dentistry. So periodontics has to do with around teeth. So the specialty of periodontics deals with the structures that support the teeth, and replacement of teeth with implants is part of this. So that's the specialty of periodontics. Endodontics, endo, just think inside. And so the specialty of endodontics is related to root canals, which has to do with taking care of problems that occur inside teeth with their pulps and pulp canals. And so we'll talk about this. I think one of the interesting things about both of these specialties when it comes to teeth is that teeth, the dentin, the enamel, hardest substances in the body, do not supply a blood supply. And whenever we have infections or problems, we need blood, because the blood is the transport for oxygen and nutrients to cells that are necessary for repair. And the teeth themselves do not contribute to any of this, and in some ways they're kind of in the way. How that relates to periodontics is when we're talking about grafting bone, putting bone near teeth, we have to keep in mind that some of that is difficult to do because of the fact that the blood supply to the area where we're grafting is limited because of the location of the tooth. That there's nothing coming from the tooth, and yet we're trying to grow bone to the tooth. And so that's the problem. It's kind of like gardening against a brick wall, growing plants and things on soil and watering it. All of that soil and plants and everything are there, but the wall does not contribute. It's just a wall, and that's the tooth in this in our situation. When we're grafting at the removal of a tooth, then we have presentation of bone in all areas, so we can fill that up. We have a blood supply because bone is surrounding the socket where the tooth was removed, and there is no obvious tooth, so there's no limit to the blood supply contributing. So the predictability of those kinds of grafts is much higher than grafting against a tooth. So all of that to get into endodontics, where you have inside your teeth a pulp and pulp canal, and that's a chamber. And inside that chamber, you have blood supply and you have a nerve supply. And these things are there. Let's talk about the blood first, is to nourish and keep healthy the cells that actually formed the dentin that makes up most of that tooth. So the dentin was formed by cells inside growing toward the middle. The cells that grew the enamel were on the outside of the enamel, and when the tooth erupted into the mouth, that sac that was overlying the enamel that was useful in making the enamel is shed away, and consequently we do not have the ability anymore to grow enamel. But inside the teeth, the canals, as people age, can get smaller and smaller because of the fact that these cells are still working and they're growing dentin. And if there's an assault on a tooth, a lot of injury or sensitivity or whatever, oftentimes sensitivity over time reduces because of the fact that these cells inside the pulp are still working and they're sealing things off, and eventually the nerve can go away, and that would be basically nature's root canal to eliminate or obliterate that inside portion, the chamber with the blood vessels and the nerve. The other thing you can know about the nerve within the teeth is that it fires off and is a pain sensor, but it doesn't tell you its location. So it is not able to tell somebody if they have a toothache that's originating within a tooth. They can say, I have a toothache and it's on my right side of my face or the left side of my face. It's a tooth, but I don't know which tooth it is because it's not telling the brain its location. So when a nerve fires off within a tooth, we call that a pulpitis. And they break a pulpitis up into two possibilities. It's either reversible or irreversible. A reversible pulpitis may be an injured pulp that recovers and the systems return to normal. There's an injury, but the cells within the tooth have the capacity to repair, and it gets better and life goes on. If, though, the pain persists long enough after the stimulus is removed, so let's say, for example, a tooth fires off because you're eating ice cream, so it's cold, and the cold gets to the pulp and it fires off that nerve. If you remove the ice cream or the cold and you warm the tooth up, does the pain go immediately away or does it linger and throb? I think the last time I heard this was at around 6 seconds, 1,000, 2, 1,000. If that thing is still hurting at 6 seconds and beyond, the likelihood is that it's irreversible. It's not going to get better in terms of the health of the tooth. Now, the pain may go away, but if it does, most likely the next step was that the nerve inside the tooth died. And so now we don't have a nerve, and that can sound like a good thing because now we're not getting the pain to the cold or to the hot. But now what happens is that chamber within the tooth, all of that material, that organic material dying, bacteria find their way there and they begin to chew on that material and multiply themselves. But again, back to blood supply, the tooth structure does not have blood, so there's no way for the white blood cells, the body's immune response, to get into where this bacteria have colonized within this dead pulp within the tooth. So what happens is where the blood meets the bacteria coming out of the tooth, that's where you have your inflammatory reaction at this point. And since the whole thing has died, what happens is bacteria begin to leak out the tip of the root where the blood vessels actually enter into the tooth. They come in at the bottom of the tooth. Their blood supply, there's blood vessels in the nerve fibers that come from the jaw, and they go into the tip of the root and up through the chambers, up through the canals to the pulp chamber. And so when that dies, reverse it, the bacteria up there are growing down. And when they get to the point where there's an adequate blood supply, which is beyond the tip of the root, then the battle ensues. And what this feels like with regards to pain is that all of a sudden, this tooth is very tender to touch because now the infection is on the outside of the tooth at the tip of the tooth. And if you touch it with your finger, tap on it, touch it with your tongue, sometimes it hurts. And that is an acute pulpitis, chronic pulpitis, something that has leaked out to the tip of the root. All right, so what do we do with this? Well, this is where a root canal comes in. What's necessary is for an entry point into this canal, usually through the crown of the tooth. The endodontist or the comprehensive dentist doing this root canal will create an access point to the pulp. And then with instruments, they will instrument out all of that organic material and shape that canal down to the tip of the root so that they can put a filling material in there, which is a combination of some cements and gutta percha, which is a part of rubber formation. And it essentially seals off or obliterates this canal so that the bacteria no longer have a place they can live. So a root canal is a filling, if you will, to the tip of the root. And it eliminates the bacteria within the tooth. And then the area where that battle was going on at the tip of the root all heals and bone grows back. So I didn't mention this, but where you have this inflammatory response, you have bone loss. And on an x-ray, it shows up. And we can say, this tooth needs a root canal because of the fact of the appearance of the bone loss at the tip of the root is telling us that the pulp inside that tooth is dead. And so that's how we can tell on an x-ray. But if a person comes in and they have pain to hot and cold, that acute pulpitis, when we take an x-ray, we may not see anything because it has not yet gotten to the point where we're seeing bone loss at the tip of the root. Now let's go back to the gentleman I was speaking with. I told him, well, we have two problems with this tooth. We have bone loss that's occurring around the tooth. That's periodontal disease. And we have bone loss that's occurred because the pulp had died long ago. And the amount of bone loss starting from the tip of the root has enlarged itself to the point where the two communicate. So now we have a periodontal bone loss and an endodontic bone loss communicating. And so this gentleman has a problem. And then it's a matter of trying to figure out, well, do we do the root canal or do we treat the periodontal disease? And the answers to these things are not all that clear. There's a lot that has to go into trying to figure this out. For example, are we talking about one tooth when it comes to periodontal disease, in which case maybe it's a fracture or something problem with the tooth? If it's generalized periodontal disease and we have this tooth that has a dead pulp, what sort of treatment should we do in general? Maybe we treat the perio first and then do the root canal. And then by this time, if we have a lot of bone loss around a tooth that has the combinations, is the tooth worth all the treatment that would be necessary? And what's the outlook? What's the prognosis? If we do all of this, are we still doing something that we would categorize as heroic care? Or is it really highly predictable and we can say with certainty that you're going to be able to keep this tooth? And those are the types of determinations that go into evaluating a tooth like this and determining whether or not it's worth it in multiple ways to treat it, or should we remove it and allow the bone to grow back and fill in that socket with bone. Remember, we have blood supply now, rich blood supply, so that we can then maybe put in an implant to replace the tooth. If we did this, would that be a stronger tooth than the one we're trying to fix? And then take into consideration that we do all of this work on the tooth and then lose it. What if we had just gone to the implant? Would we have saved a lot of money? So those are the kinds of things that become challenges and why it's important to understand the area of the root canal and the endodontist. They're amazing people in what they do. Again, the kinds of pain that people will have with a tooth are different than the pains they will have with the gums. in general. Acute pain from teeth is the classic toothache. And when you're having pain from the gums, it feels like dull aches and soreness and swelling, that sort of a situation, and you kind of know it's tender, but it isn't the real sharp pains, the throbbing pains. So we can differentiate those two. That helps us figure things out and be able to treat patients appropriately. Anyway, that's it. I'm gonna stop there. I hope this has been helpful. Root canals are wonderful ways of retaining teeth, and an implant's a nice thing, but if we can keep the teeth, that's the first preference for all of us. Implants are a substitute for the loss of a tooth, but if we can keep the teeth, that'd be fantastic. And it's nice to know we have back doors where when some problems occur and we can't solve those, we have other ways to address things. So thank you for listening. And if you like this podcast, please tell your friends and subscribe. Again, this is Dr. Ben Young. I'm a periodontist practicing in San Antonio, Texas, and you all have a nice day. I'm reading a book about anti-gravity. I just can't put it down. Now go fly.